I do find people with Lyme disease and other tick-borne infections, they will get more fatigued like faster than maybe they did before. So I always tell people kind of to do it gently. Like I've had people that were marathon runners or even Ironmen, and they're like, I can't even run now like 2 blocks around my neighborhood. And I used to do marathons. And a lot of that is because we need to, again, restore the mitochondria, like you mentioned.
So on today's episode of the Modern Vital Podcast, we're going to talk a little bit about Lyme disease and tick-borne illness. And today's very special guest is Dr. Jaquel Patterson, nationally recognized naturopathic physician, success coach, best-selling author. She owns a successful multidisciplinary medical practice, Fairfield Family Health in Connecticut. She has over 16 years of clinical experience with a focus on Lyme, autoimmune disease, integrative psychiatry, environmental medicine, and she's also active in leadership within the profession, serving as the past president of the American Association of Naturopathic Physicians, and currently serves on the board for the American Academy of Environmental Medicine. Her clinic tagline is healthcare as it should be, which I just love. Welcome to the show, Dr. Jaquel.
Thank you. Thank you so much for having me, Dr. Reebs, a big fan of yours. So really delighted to be here today on the podcast.
It's so great to connect a little bit. So I'd love to just hear a little bit about your story. How did you end up treating so much Lyme and tick-borne illness?
Yeah. So actually, almost all the areas of focus and specialty for me in my practice, including Lyme disease and autoimmune conditions, have either, a personal, either impacting me directly or a family member. So for me, I started working with patients with Lyme disease. And as I started, I guess, learning more about it, because we are based in Connecticut, which is a big area for Lyme disease, or the Northeast area, but it is all over the country. So a lot of people think it's just endemic to the Northeast area. And so after treating patients, I was like, wait a second, these are many of the symptoms I had myself, 5 to 10 years ago. And when I was in naturopathic school, I had a lot of migratory pain, continual headaches, really bad fatigue, and also a lot of anxiety and like hot flashes. So I was so hot to the point that I didn't even realize I was wearing black for like the last year and a half of school. And I would be drenched all the time. And so when I later tested myself, I was positive for Babesia, which is very commonly known. It's a tick-borne infection to do that, as well as Lyme disease. But at the time, I was getting worked up, just like many of the patients most people with Lyme disease see, 7 to 9 doctors. I went to primary care doctors, I went to rheumatologists, and I did have some positive markers, which led them to think, okay, maybe I have an autoimmune condition because my mother has lupus, my aunts have lupus. So it made sense. But then the full picture didn't really match up. And then later to find, many years later, that that's what I was struggling with. At the time, I did do some herbal medicine. I did a lot of mind body. Like I just really took care of myself. And luckily, for the most part, symptomatic, I was mostly symptom free. But it was actually from working with people that I was like, this feels very much. And the crazy thing is, we learn about it in our medical program, but there's not really a deep dive into it to really understand how to use that by way of like differential diagnosis when you're really seeing a patient.
Gotcha. So then did your diagnosis kind of come later as you were working with patients and you really realized and kind of addressed it full on? Or?
Exactly. And then I did like full treatment. Interestingly enough, I was IgM positive. So even though it looked like I had IgG, plus I had IgM positive, meaning more recent infection, or I could have, gotten bit again or reactivated, et cetera. So I definitely went through treatment, did herbal medicine, and just felt like significantly better. And so the most interesting thing was the migratory pain, because it plays with your head where you feel like my arm's hurting. And then like next day it's like magic, it's gone. But now it went to my knee. So you start feeling like, and a lot of the patients say it's like in your head, like you feel like you're making up a story, or am I going crazy, or am I going mad? So a lot of patients often, that's one of the stories they say to me, especially if they've seen tons of doctors as well.
Right. So can you just show the audience a little bit before the difference between IgG, IgM?
Oh yeah, of course. So IgG, so IgM is more of a recent infection. So it's typically 3 months or less. And then IgG tends to be 3 months or more. However, there is some, conflicting pieces of, can you be IgM too for a long period of time? Or could it get turned on? Like I saw when people had like COVID or a virus where it was IgM, we know that they didn't necessarily just get exposed to it. So there are some people that keep that active, like IgM, for longer periods of time than the 3 months. But in general, that's what it typically is. And the other thing is, if you do get bit by a tick, you're not going to necessarily show with antibodies for about 4 to 6 weeks. So that's another thing I often tell patients, because they want to test right away. They got bit, they might have a bullseye. And I always tell them, like, the test is really not helpful at that time, because it takes about 3 or 4 weeks before the antibodies build up for it to actually show positive in the lab test.
And you were positive for babesiosis as well as Lyme.
Exactly.
Yeah,
Yes.
got it. Well, what are a couple of things, like essential things? I mean, I've obviously
Mhm.
been working with this for many years now, and I know you treat the whole person. You're really looking for those root causes. But what are a couple of modalities or therapies that you've just found to be essential tools in helping people kind of kick it into dormancy, sort of resolve these symptoms, kind of clear it, so to speak?
Yes. And the other thing I always work on is, we do as naturopathic doctors, is prevention. Like, what are you doing when you're going outside? The clothing, what are all your procedures? So that's also after, because especially depending on where you live or what type of work you do, if you're a gardener or hiker or something where you're outside pretty frequently, there's just a higher likelihood of exposure. So also not only treating, like, what do you do to prevent that from happening again? There are tons of actual herbs that have been. So I typically will do herbal medicine, and then I also will do nutrients by way of like supplementation. And typically I try to put patients on a diet that's basically less inflammatory, like more, food, like avoiding obviously like things that are more acidic, like coffee and alcohol and all the basic things, looking at gluten, looking at dairy, like what are the things that are going to make your system not work as well. So nutrition also plays a role. But there have been several herbs that have been like heavily studied. You can see them in PubMed too, that are shown to be as effective, if not more effective, than some of the antibiotics that people use for Lyme disease.
So do you, I mean, I know there's so many different variations of Lyme, and obviously we've got mild, we've got moderate, we've got severe, and then we've got all these co-infections, and then all of these other things like Epstein-Barr or mold
Mhm.
or long COVID. I mean, so many things we see typically with Lyme or often with Lyme. Do you often see patients able to resolve the issues pretty readily, or does it just depend on the person for you?
I think it depends. If somebody's had it for 10 or 20 years, it's harder, because I always say at that point, Lyme disease is almost acting like an autoimmune condition, because there's not a reason. You'll have somebody, a wife and a husband, and the husband may have bands even higher, but have no clinical symptoms. And then another person, their wife has been struggling with it for 20 years. So then the question is, why is one person struggling for a long time and the other? So what is their foundation? What is their stress level like? With women, I'm looking at hormones. Like, what are all those impact, things that are how is their immune function that's preventing them from like actually clearing it? So I think with the approach, I try not to work, especially if someone's had it for a long time, on just pure antimicrobials, because if that hasn't worked and they've done antibiotics, which we see people on for years, and they've done antimicrobials for years and it's not working, there's something else. And that's when you have to look at things like mold, things like, environmental medicine factors, things like other viruses. Like some of my patients, they say they had like EBV or mono, like they might be like 25 or 30, like 10 years ago. And that's kind of where their system kind of went haywire. So I have to address that, because if we don't address that, then to me, it's harder to really like help to support Lyme disease and clear it if you're not addressing those other factors. So I think that's why you have to definitely go to someone like you or me who's really literate in looking at all those pieces, because sometimes it's hard to prioritize. And I always try to be mindful of kind of doing it in buckets, so it's also not overwhelming to somebody with, a million different protocols to address a condition too.
Yeah, it's amazing how, if somebody has a ferritin of, say, 10, or maybe has really low natural killer cells,
Mhm.
or, leukopenia, like low white blood counts, or whatever, it may be some hypothyroidism. It's like until we get those things addressed, or I should say, when we get those things addressed a little
Mhm.
bit, it's amazing how the Lyme often gets a little better by
Exactly.
working with all these other factors.
And it's funny that you just said ferritin, because I've seen that a lot with like so many of my patients, and it gets untested a lot because they just do the complete blood count, the CBC, that they have low ferritin. And ferritin is actually one of the ones, when there's acute inflammation, it'll decrease. So it'll go up high and then it drops. And so, especially I saw after people got sick, there would be this lowering of it. And so you're right. Like I've had people, we just get their ferritin levels up and now they're able to respond better. So those are just like basic core things that get like not looked at sometimes when you're, only addressing looking at Lyme disease and only retesting that and not looking at like what else can be going on.
Yeah, absolutely. I'm curious, what role do antioxidants play? I mean, for you, I mean, you probably have your favorites, whether it's glutathione or zinc or
Yes.
do you
Yeah.
end up kind of rotating through some, or do
Yeah,
you kind of have your
yeah,
go-tos?
CoQ10, yeah, so alpha lipoic acid, especially if the person has any neurocognitive, because with Lyme disease, you mentioned, stage 1, stage 2, stage 3. So later phases, people have more neurological symptoms. Even I've had people with Bell's palsy, dizziness, coordination issues. And so some of those are also related to other tick-borne infections like Bartonella, depending on which one they are. But one of the things with tick-borne infections is they really use up the mitochondria. And so you really need to replace anybody you're with a lot of antioxidant support. So CoQ10 is one. I've had some patients where like they were just on, that was the thing that worked for them. It was just CoQ10. Like it worked before I even had a chance to fully look at everything else with the antimicrobial. So that's kind of interesting. B vitamins, especially because B vitamins feed the adrenal glands and the thyroid, especially things like B5, B6, B1, if there's also a lot of like cognitive issues. And also, yeah, glutathione is one of my favorites, especially because I'll often have patients that have some type of mold exposure. So it also helps to support any kind of environmental exposures as well. And also hormones. So
And are you using NAC quite a bit too to kind of build
yes.
glutathione?
Yes.
Yeah.
Yeah. And that's actually what comes in too. Some people will have taken one versus the other, and they'll often do better, with both of them or maybe one. So that's also an interesting thing to kind of work through. But NAC was like, I feel like after 2020 was like the hot, like I feel like it was everybody was on NAC for respiratory support as well. So, and it's great as an antioxidant. So both of those are awesome because they're multifaceted and how they can actually support somebody too.
And are you using some hyperbarics as well at times, or referring out for that, or?
We refer out. We don't, but we are about to, in my new clinic, we're getting the hyperbaric. So that'll be in the next few months. But we also, the other things that have been studied and helped is sauna, far infrared sauna is another one. Also, far infrared sauna has been connected with supporting like cognitive function as well as cardiovascular function for about 20 minutes, not for as long as people think. But I do find people with Lyme disease and other tick-borne infections, they will get more fatigued like faster than maybe they did before. So I always tell people kind of to do it gently. Like I've had people that were marathon runners or even Ironmen, and they're like, I can't even run now like 2 blocks around my neighborhood. And I used to do marathons. And a lot of that is because we need to again restore the mitochondria, like you mentioned, but we also need to build people up shortly. So sometimes I'm like, okay, just get into walking. There's tons of studies that show walking every day for 5 miles is just as effective as our American styles like hit intensity workout 3 times a week. But really, if you're consistent doing 5 miles a day, you'll stay still as active and have just as much like cardiovascular benefit. So I try to build people up shortly too, and to not, for people listening in to get discouraged by that you're also like deconditioned, so you're not going to jump back in the same way, but also building up slowly because I find sometimes when people just jump in, I'll have someone that feels well. They used to hike all the time. They're like, "Oh yeah, Dr. Patterson, I went and hiked 8 miles," and then they had to pay for it for a week. I'm like, "Well, but you haven't done 8 miles, in a year, so you have to like go slowly." So that's also a piece of trying to build up and prime your system, and being smart in terms of getting back into some of the things that you used to be able to do before that might have been easier.
Yeah, it's amazing how many endurance athletes I've been seeing that kind of got tipped, after just maybe pushing it a little too hard, did a couple marathons, and then they got tipped into a full-blown Lyme or long COVID or something else. And then the Lyme was actually found after their body tipped into that state. Seems to be a fairly common thing. Well, thank you so much for joining us. Where can people find you online?
Yeah, sure. So my website, I just did a Lyme Healers Summit, which we're gonna plan on doing it every year or at least once a year, maybe twice a year. So check that out. It's called Lyme Healers. So the focus.com was on inspired by having a focus on like women and children needs as it pertains to Lyme disease. But I also have my practice website, which is fairfieldfamilyhealth.com. And we have a really multidisciplinary practice. So we have docs that all have kind of different focus areas, including one that does like more neurology. So yeah, definitely check us out there and follow me on Instagram at naturopathic physician.
Awesome. I'll make sure to link to all of that in the show notes. That concludes today's episode of the Modern Vital Podcast. We'd love to hear from you. We really value your feedback. And if you have any questions or suggestions, please reach out to me at ben@modernvital.com. Also, please leave us a review if you enjoyed this episode. And we look forward to having you join us next week for another exciting episode of the Modern Vital Podcast. And that's a wrap for today's episode of the Modern Vital Podcast. Your support fuels our mission to empower you on your quest for optimal health. Remember, our Modern Vital store offers supplements to guide you on your path to wellness. And don't forget to subscribe, leave a review, and share our podcast. Until next time, stay proactive on your health and wellness journey.